Hi everyone, I'm Dr. Tan Iping, consultant obstetrician and gynecologist. Okay, so today we're going to talk about a topic that affects a very big proportion of women out there. What we're going to talk about today is called PCOS. Some people call it PCOS, some people call it PCOS, and it stands for Polycystic Ovarian Syndrome, okay? Polycystic Ovarian Syndrome. So just based on the name Polycystic Ovarian Syndrome, we already know that in this condition, the ovary have multiple cysts. This name, although it's called polycystic, but actually the ovary got no cysts at all. What happens is that it looks like you have multiple cysts. What is polycystic ovarian syndrome? It's actually a condition where when we look at the ultrasound of the ovary, we see tiny little cysts, tiny little round things that look like a cyst, but it's not a cyst, it's actually the ovum, which is the eggs that are supposed to come out. Because women with polycystic ovarian syndrome, they have problem with ovulation. So they have so many eggs in their ovary but doesn't release out, so it accumulates many inside the ovary. So it looks like many cysts. In fact, we always say it is a necklace of pearls. So pearl necklace, where you have little pearls all around your neck. So all around the ovary they have little round black color thing. And it looks like cysts, but it's actually not a cyst. So not to worry, number one, because a lot of people think cyst is a growth, cyst can be cancer. So they're very worried when doctors say they are polycystic. They're so worried. But actually, it is not. It is just your little eggs that never come out for many years. So that is why you see as polycystic. Because it's very much linked to diabetes. So because it's linked to diabetes, it's also linked to your age. It is also linked to your weight. So you may not be ovulating at all, or you may be ovulating on and off. Okay, first you need to know it is called polycystic ovarian syndrome. So it's also not a disease lah. It's not really a disease. You're not like having hypertension, diabetes, or heart problem, or stroke, or what. No. Polycystic ovarian syndrome is not a disease, okay? It's just a syndrome. Number one, we know their menses is always irregular. So the first criteria for polycystic ovarian syndrome, first is their period is irregular, okay? Period is irregular, number one. And they tend to be overweight or underweight, and they also tend to have high cholesterol, heart disease, stroke. All these things is together when it comes to polycystic ovarian syndrome. So as far as gynae, we talk about irregular menses. So when you have irregular menses, it's also a bit difficult to get pregnant. So because they, as I said earlier, they do not ovulate. So first, they have irregular menses, they tend to be overweight or underweight, they have difficulty in getting pregnant, and last of all, they also have a higher chance of uterus cancer. So PCOS and uterus cancer is linked. And the rest of you who want to know more about PCOS or any other things about gynecology, I have already 20 to 30 videos out there already, and we upload them all in my YouTube channel. So go to my YouTube channel, which is Dr. Tan City Clinic. There you can find, number one, you can find a video on polycystic ovarian syndrome. You can also find video on fertility. You can also find video on uterus cancer. So if you want to know how to protect yourself from uterus cancer, go and look up my video in my YouTube channel, okay? That's all for today. Any more questions, please put in my comment section. So that's all for today. See you. Bye.